Now usually by this point everybody's a little tired and your eyes are a little strained, and so we don't want to get too fussy with it today, but rather have the patient come back, and then when we're all fresh we'll sit down and critique and look for ways to enhance and improve. But I'm starting to develop a pretty good sense of comfort with what we have here today. So we're going to go on and smooth and polish all of it and get it to a place where it feels reasonable to her lips and tongue. We always explain to the patient that this may look a little better than it feels, and that recognize that when we do the permanent insertion with the ceramic, that it'll be very slick and smooth and no seams that you can feel or anything like that. However, with this composite, the way we're applying it without etching the entire tooth, and as quick as we're doing this, relatively speaking, then there may be a little bit of roughness there. So we look one more time from the incisal view to be sure we have our lobal development and the basic anatomy. I do see a little bit of quick changes I'm going to make with a sandpaper disc. I like to use the disc sparingly, but I can go in and flatten in some areas to create depressions and a little more appropriate facial surface. This is probably a good time to step back now and let's look at her lateral excursive movements and be sure we have proper guidance. So let's see the articulating paper. You want to caution your patient here not to bite too hard. So we want you just to close here, Christy, and then just slide your lower jaw, bring your chin forward all the way out end to end with your teeth, and then go back and open. We'll take a look at that first. Looks like we might be catching this left lateral just a bit. So I'm going to smooth that off. Now close together and bring your lower jaw to the right side, or not too hard, okay? Keep going over there a little bit more. Now I just heard a little pop noise, so she might have chipped just a little bit of that. We'll check it and open. Okay, we're going to go the same thing the other side, but not too hard. There you go. Perfect. Close back and open. Let's relieve that first bicuspid just a bit. Open. Okay, so ladies and gentlemen, I think we are ready to smooth this up one last time. You can use your favorite polishing points and cups for this procedure. I'm using an enhanced cup to just do the rough smoothing. You certainly want to leave as much of your anatomy as you can and not flatten everything out excessively and over smooth it. But at the same time, you want to get rid of the scratch marks and get basically into a smooth place. Now I'm coming back with a Shofu yellow polishing cup. It gives us a little more gloss. You can just bypass all of the smoothing and put an unfilled resin coat and cure that real quick. Sometimes if we're in a real hurry and behind in our schedule, perhaps we'll look at doing that. But if we have the time, we would prefer to go on and put a hand polish here with instruments. Our final polish, we like to use a Robinson bristle brush. And we use Diashine, very similar to how we would polish up the ceramic. And it works very nicely for composite as well. So here we're using some Diashine. We use a low RPM, not too fast. Moderate pressure on the teeth. Notice my assistant is putting pretty strong air on this as I'm polishing, because you can generate some significant heat. Okay, so we're going to choose to stop here today, even though there's a bit more refinement that I can see that would be helpful. So after finishing up the prototypes today, it's now time to send the patient home and do what we call a test drive. In our practice, normally this is 2 to 3 days that we ask them to check this out, to look at it very carefully, particularly from conversation distance, about 3 feet away, to get the opinions of family and friends and loved ones, and then return to us in 2 or 3 days and let's make any changes or tweaks that we may feel important or that they may guide us to do. And then at that point, we're going to capture a new impression and a full series of photographs, which we'll send to our lab, and this will of course be the blueprint now for the case. The case we did today is pretty typical, and we're very excited about it. Now we send it off to the lab. We make the handoff just like in a football game. We hand the ball off now to the lab, and we look forward to getting their final product back, and we'll enjoy delivering that in our second part of this video series.